Garlic has been used for over 5,000 years by ancient Egyptians, Greek athletes, Roman soldiers, and traditional healers on every continent. But modern science has now decoded exactly why it works. And there is one simple trick almost nobody knows that doubles its power. Garlic's secret weapon is a compound called allicin. But here's the thing, allicin does not exist inside a whole garlic clove. It only forms when the clove is cut, crushed, or chewed, triggering an enzyme called allinase, which converts a stable molecule called alliin into allicin. And here is the mistake almost everyone makes. Most people cut garlic and immediately throw it in the pan. When heat hits the enzyme in the first few seconds, it is destroyed before allicin can fully form. You get the flavor, but you lose most of the medicine. The fix is simple, the 20-minute rule. Crush or finely chop your garlic. Set it aside on the cutting board for 20 minutes before applying any heat. This gives the allinase enzyme enough time to fully convert alliin into allicin. Once allicin is formed, it is heat stable, so your cooked garlic retains its full benefit. For maximum potency, go raw. Raw garlic delivers the highest concentration of allicin, roughly 2 to 4 milligrams per clove. Mince it fine, wait your 20 minutes, then add it to salad dressing, hummus, guacamole, or a simple olive oil and lemon drizzle. The fine mince exposes more surface area, generating more allicin. Raw garlic on an empty stomach is a traditional practice backed by modern research. A 2016 meta-analysis in the Journal of Nutrition found that regular garlic consumption lowered LDL cholesterol by up to 12% and reduced total cholesterol significantly. Effects seen primarily with raw or aged garlic, not cooked. For your heart, garlic is one of the most studied natural interventions. A review of 23 randomized controlled trials found garlic supplementation reduced systolic blood pressure by an average of 8 points and diastolic by 5 points in people with hypertension. It also reduces arterial stiffness and lowers markers of inflammation like C-reactive protein. For immunity, allicin is one of the most potent natural antimicrobials known. A landmark study published in Advances in Therapy found that people who took a garlic supplement daily had 63% fewer colds over 12 weeks. And when they did get sick, their recovery time was cut in half, from 5 days down to less than 2.5. Beyond raw, two powerful preparations. First, garlic honey. Pack minced garlic into a jar, cover with raw honey, seal, and leave for 1 week. The fermentation mellows the sharpness and preserves the allicin beautifully. 1 teaspoon daily. Second, garlic-infused water. Crush 2 cloves into a glass of room temperature water. Wait 20 minutes. Strain and drink first thing in the morning. How much? 1 to 2 raw cloves per day is the research-backed dose. If the smell concerns you, chew fresh parsley immediately after. Chlorophyll neutralizes the odor compounds. The 20-minute rule: a sharp knife and 1 daily clove. That is all it takes to use one of nature's most powerful medicines correctly. Important cautions before you start. If you take blood thinners such as warfarin or daily aspirin, speak to your doctor first. Garlic has measurable antiplatelet activity and can increase bleeding risk. Stop garlic supplements at least 2 weeks before any surgery. People with acid reflux or GERD often find raw garlic worsens symptoms. Pregnant women should stick to normal culinary amounts and avoid garlic supplements entirely. Garlic is not a miracle cure, but the science is real. Allicin, the 20-minute activation rule, raw versus cooked, 1 to 2 cloves per day. These are evidence-based practices supported by dozens of clinical trials. Start tomorrow morning. 1 crushed clove, 20 minutes, then into your breakfast. Your heart, immune system, and blood pressure may all thank you.